Good evening, everyone, and welcome. We're going to be talking about the vagus nerve and why it is important. We realize you could have lots of questions, and Dr. Justine has made herself available by text. Just give her a text at 647-987-9355. I wanted to welcome Dr. Justine with us today. She's our leader here at Justine Blaney Wellness Center, an incredible advocate for your health and in the community itself. Please help me welcome Dr. Justine.
Hello, everybody. What a great topic today. But we're going to be coming up with amazing topics every single week. So, learning about cravings, that sweet spot, when you really, really want that chocolate, and how to deal with ways to have healthier six great foods to manage that sweet spot and when we want that junk food. We're going to talk about the most contaminated foods and the ones to stay away from, the dirty dozen, if you will. And very importantly, those with chronic disease, inflammation, degeneration, arthritis, MS, AS, RA, the other different forms of arthritis and skin conditions like psoriatic arthritis. We're going to be talking about inflammation that's coming up soon. And lastly, we have our boost your metabolism and improve your metabolism makeover. So all the time, we just have amazing information. We've got the next 6 months planned just for you online. And we look forward to seeing you, being with you, and of course, share this information with friends. So today we're talking about vagal tone, how to improve your mood, your mental health, your stress. These are stressful times. So this is just such an important time to talk about a very, very cool nerve called your vagus nerve. So the vagus nerve, super important. It affects inflammation, affects your heart, affects your gut, affects your liver, affects your brain, affects your blood vessels, affects your mouth. It affects how you taste things. This is one of the most amazing nerves that we have. And when it's functioning well, your body's doing well. When it's functioning badly, you're not doing well. So it is one of the 10th cranial nerve in your body. It is the longest nerve, literally going from your brain all the way down to your digestion. So that's why they call it the wandering nerve. And there's one on either side, and it can affect your autonomic nervous system, your automatic nervous system. So it's going to affect your digestion, it's going to affect motor and sensory functions. It's going to affect your heart, your lungs, your airways, your esophagus, your intestines, your blood vessels. So super important. And we're going to bring this to ways how it can affect your moods, but also how you can deal with vagal tone therapy, how you can deal with ways to improve your vagus nerve. So when you have a healthy vagus nerve and a healthy vagal tone, you feel calm, you feel peaceful. You can maintain that positive mood even when times are stressful. Your digestion is better, your bowel movements are better, your blood pressure is better. You can maintain a healthy weight. You can speak and swallow more easily. So when the vagus nerve affects your parasympathetic nervous system, this is the one that kind of just slows things down. So it slows your heart rate, helps control sweating, helps involve contraction, muscle contraction, helps your blood pressure, helps involve with your gag reflex and relaxing those muscles. If it's gone overkill, it's going to make all of those things worse. And that can affect dysautonomias, meaning your nervous system or your autonomic nervous system isn't functioning well. It can affect things like your postural, orthostatic tachycardia syndrome. So, again, affecting your blood pressure, affecting your vasovagal reflex as well. So, it can affect for example, where I've seen this happen is somebody's stress is so high that they faint. All right, they have a sudden drop in blood pressure. So it is definitely a super important nervous system. One of the ones that we can work with also by affecting with hiccups, supraventricular tachycardia. So dealing with how the vagus nerve affects your heart. And in many cases, when they do therapy, polyvagal therapy to help the stress response, this is an area that can affect things to calm the body, dealing with helping people with migraines, fibromyalgia, weight loss. It can be looked to affect tinnitus and other inflammatory conditions. So super, super important to help our body be better connected. So when you look at this, slide, it talks about connection. That's when things are going really, really well. That's when we feel grounded. That's when the slide right before, Angela, feel grounded, compassionate, mindful. That's that green section. But when the body goes overkill, you get this adrenaline rush, and that's when we're panicked, we're fearful, we're worried, we want to run, we're angry, we're irritated, we feel aggressive. That's when this adrenaline is rushing, and then we can have the other response of just complete shutdown. And an example can happen for this. I remember when my stepmother passed away. At first, I just ran around cleaning the house. And my husband's like, "What is wrong with you?" I needed to work. I needed to move. And then when it hit me, I ended up being on the couch like 24 hours, just didn't move, you know? So vagus stress can hit people differently where they just gotta go, or they just crash. And then even in the animal world, you will see an animal that's running away from the lion, running away from being a prey. And then when they're caught, they tend to just crash. They lay down, they almost like play dead. And then if the animal, for example, the lion or the gazelle, just sort of takes a break, all of a sudden they get that second rush and run away. So we do have these ups and downs and how our body responds to this adrenaline rush. And our goal is to have a better balance with the parasympathetic and sympathetic nervous system. So if you look at the next slide, you will see that it's almost like a teeter totter of the sympathetics and parasympathetics. And we want that balance. When the parasympathetics, that's the brake pedal, just like slow it down. And sometimes my husband will tell me I need to slow down. And this is when we, sort of rest, recharge, we improve our digestion. So that's why it's often called rest and digest. Whereas the sympathetic nervous system is more of the fight or flight. This is when we're going to go hard. The adrenals are functioning really, really fast. This is our stress response and often our survival response to get out of the way. And so the ultimate goal, if we can, is homeostasis, a balance, a dynamic balance of the toes. We're never going to be fully in parasympathetic, but we want to be able to have a better balance and be able to adapt quickly to any stress, any fight or flight response. When we do have that fight or flight response, cortisol goes like crazy. And where our epinephrine, our norepinephrine, everything starts to get super stressed. And so that's when you could almost be trembling that you can't speak. That's when you can have diarrhea or constipation. You're super hungry, or you're so stressed you can't eat. That's that flight or response. And that's also when you see things like road rage, or people just angry, or they say things that they don't really mean. They're not themselves. And then they can go through, if you see it, the freeze response, like what happened when my stepmother passed away. Just needed to crash before I can get back on track. So our goal is to get that balance. And you can see social engagement is one of the ways when you can have that joy, be in the present moment, be curious, be open-minded, be mindful. This is where we want to get that balance in the ventral vagal tone, whereas you see the opposite of that sort of bell curve can be very, very stressful on our healthcare. So when we want good vagal tone, this is when it helps lower our blood pressure, lowers our heart rate, helps us manage our stress and our moods, helps our gut, because our brain, these long wandering nerves goes from our brain to our gut, helps us breathe better so we're not just shallow breathing, and improves our speech. Many people even could end up with tremors or so much tension if they don't have that vagal tone. If they have poor vagal tone, this is when you can, get an upset stomach. If you're super nervous for a test, super nervous for a presentation, feeling anxiety like you can't sleep, your stomach is upset. You might feel nausea. You might even feel like vomiting. I know when I was writing my board exams, and I remember in chiropractic college, my pathology exam, I really just felt like I was going to throw up. It's going to affect blood pressure, can be fluctuating, could be a gag reflex when you try to eat, you just really can't eat. It can affect our stomach acid, our voice, even our ears. Some of the major causes of this vagal tone on the next slide, you will see can be really, really poor stress. Um, even early stress, especially trauma or different abuse in the home, different traumatic experiences. And one of the things we have to aware is that it doesn't have to be the major traumatic experience like physical or sexual abuse. It can be what's perceived as a traumatic experience, like somebody not recognizing you, somebody not giving you a phone call that you expected a call from them, somebody ghosting you and not getting back to you, or a compliment that you thought you did good work and nobody recognized that good work. It's how you perceive that trauma is what matters. So it doesn't have to be the big T's. It can be the smaller little repetitive traumas, especially at a young age, that creates that formation. Different head injuries and concussions, breathing exercises for breathing really, really shallow makes a difference. Blood sugar imbalances and toxic load. So we're going to review some of those steps right now. So if we look at the chronic sleep, you can see all the different areas affecting anxiety, your muscles, your tension, your fatigue. We know that if we don't sleep well, it affects every single organ in your body. So that's why we have lots of wellness talks already on our website about getting a great night's sleep. But if I say one thing right now, it's go to bed early. All right. Get to bed. The hours before midnight are what count. 12 to 8 is not the same as 10 to 6. So we do need to make sure we prepare our environment and get the hours before midnight. So number 2 cause is that early brain trauma. So you can see that normally the triangles there for the neocortex, the part of our brain that does most of the work, the cognition. If we have normal development, it develops really, really well. We have social engagement. We're able to adapt well. But if we have early trauma, early challenges as an infant, as a early childhood, as a teenager, that affects later cognition and vagal tone. The 4th cause is breathing mechanisms, and many people just breathe shallowly and they don't even know it. And when they're breathing shallow, their scalenes get super tight, their shoulders come up. And I talked to a patient just yesterday and didn't realize, I just had to keep saying, bring those shoulders down. And the next thing they were up, bring those shoulders down. So we actually had to practice muscle contraction relaxation exercises, which is on previous talks on stress management that I recommend that you take a look at. Next thing is concussions, and I have dealt with many concussions myself, so this is very personal for me because of years of playing hockey, years of playing sports. That can affect things like headaches, migraines, fatigue levels, your sleep, your appetite, memory, your ability to deal with light. And head trauma can affect, again, your vagus nerve and affect all the way down through your body. So, when someone has a concussion, they can't be on the computers a lot. They can't manage light. They have headaches, neck pain, tension through their neck, affecting their stress response. So their vagus response is hyperactive. The next one, number 5, is biotoxins. And biotoxins are everywhere. There's so many toxins in our environment, whether it's mold or plastics or processed foods or non-organic foods, beauty products, cleaning products, medication, smoking. All these toxins are everywhere that affect our spine and nervous system. And that can also lead to things like stress and depression and fatigue and memory problems, brain fog, even neurodegenerative diseases. One of the ones that I personally dealt with was mold. And we had a leak, shingle, a leak in our roof right before Christmas, and led to mold in our roof. And so we had to, reshingle, get rid of all the insulation. And the mold made me very, very sick, but it didn't affect, I had 0 symptoms for my husband and my son. That doesn't mean that it was good for them. And one of the biggest challenges is and many of us can have parasites, viral infections, bacterial infections, and yeast infections, and they're at a low grade. So we don't actually have symptoms we perceive. And so we don't take care of it. And yet we might need more sleep, or we might be more moody, more angry, or less concentration. But we don't know why. We don't realize that our body is being affected by these toxins. The next one is blood sugar levels. And we all know this. If we have sugar, we get that rush and then we get that crash. You can see that on the chart ahead of you as it goes below that pink level. And so then what do you want? You want more sugar because you've just crashed. So it's affecting those insulin levels and that stress response. And the last one there is that toxic load, again, affecting your liver. And these toxins can come in through your lungs, your skin, your gut. So creams that you can put on your body or spray on your body, and perfumes, colognes, all of these actually still affect our vagal tone, affect the stress response, and therefore affecting all our different organs. And if you look at the bottom, it can affect our fat cells, our bone marrow, our liver. It can affect our joints, our tissues, our muscles, our blood. So it can have a very, very systemic effect, these toxins. So how do we test for vagal tone? We're going to go through there, because how do you know if you have a problem? If you're being your vagus nervous system, your sympathetic nervous system is on overkill. So pupillary constriction test, heart rate test, heart rate variability, blood pressure, and orthostatic hypertension. And coming up, we're going to have some solutions. So stay tuned with us. So if we look at the pupillary constriction test, that's with your eyes, you should have a response to dark light. You should have a response to a light into your eye. So what happens is you set up the room in a dimly lit room, and you take a flashlight on an angle, and you look at how your eyes naturally constrict. And you can see that if you have a response that stays constricted for about 20 seconds, that's good. However, if beyond 20 seconds your eyes flicker or you have immediate dilation, you know that your body is under vagal, or what we call HPA, exhaustion, failure, fatigue, adrenal fatigue. Next one we want to look at is heart rate variability. And so we do have a normal heart rate somewhere between 60 to 100. As an athlete, mine is closer to 42 to 44, so it could be much lower. Your breathing rate somewhere between 12 and 20 breaths a minute. This is both areas, things that you can improve. But when you look at comparison, this is how, and heart rate variability, we can look for a stress response on our bodies. Obviously, if our heart rate, our blood pressure is high, our body is trying to respond to a stimulus or a tension in our body. So different ways that you can check abnormal heart rate, ECGs, blood pressure medications. There are some more difficult ones that you have to do with the medical system, but you're looking for a better balance between the different heart rates. So many people might wear a heart rate monitor. You can still get adjusted if you have a heart rate monitor, but you're looking at balance over a 12-hour, 24-hour, 48-hour period to see how your body is responding to stressors throughout the day. The next one is heart rate variability. You're looking to get that better balance and adaptability for the heart rate variability over time. And if you do have that adaptability, you're going to be able to do exercise better. You're going to be able to think better, be lowered blood pressure, even under stress. Overall, you just feel that much healthier. Blood pressure is another way. The adrenals and the vagus nerve play a role in your blood pressure. You want to aim for 100 to 140 over 60 to 90. They say the ideal goal is about 120 over 80. Athletes might have a little bit lower. Mine's typically 110 over 70. So again, it's just looking at those stress hormones. And if it does go over 140/90, that does indicate that you have poor vagal tone and that your nervous system is on overdrive. Your sympathetic nervous system is going crazy. If it goes super low, remember that that could be like you're going through that freeze state. Like I recommend said, when my stepmother passed away, sometimes when your body's overstimulated, it does need to have that crash response. And the last one that we're going to go through is orthostatic hypertension test. And this is very rarely done, more by your medical doctors, more often done with naturopaths. This is when you take your blood pressure laying down, keep the cuff on, and then stand up. And you should see that it rises your blood pressure by about 10. And I have done this test. And when I am under stress, it just doesn't rise, it stays the same. And that can indicate that your body is going through adrenal fatigue. It's just overstressed. And when that happened to me, I remember my kids were little, just running around with the kids every day, typically sleeping 4 to 5 hours a day, with a 10-minute nap here and there to try to get through the day. It was just really crazy times of being in running a business, working 70 hours a weekend, getting your kids to all their activities at the same time. So your body can get overrun, and you can see that done with this doing your blood pressure, but doing it from a laying down to standing up. So if you have a blood pressure cuff at home, try it. Laying down for about 5 minutes, keep it on and retest once you stand up right away. So we've seen that there's ways to test it. There's ways to test your vagus nervous system at home, but there's also solutions, and that's what we want to go through with you today to be able to help you best. So number one, we want to improve that sleep to de-stress, and that can be done by meditation or prayer before bed, journaling, gratefulness, going for nature walks, especially with being in lockdowns and being inside. We got to get that fresh air, get outside, get exercising, Epsom salt baths, using essential oils with your baths, having a very good pillow. Invest in your pillow, invest in your bed, because that's when you repair and you rejuvenate. Just making sure that environment is cooler and you have a really, really good, safe environment away from electronics in your bed. The second one is working on that gratefulness time, especially right for bed and when you get up, even if it's just 2 or 3 things that you're grateful for, because that improves your mood, improves your energy to start that day and end that day. The number 3 is laugh. All right. Gets the right endorphins and helps those parasympathetics. It helps you have sort of less stress and improve your creativity, improve your memory. So put on things that, whether it's on TV, sometimes when I'm working out, I put ridiculousness on, put a comedy on, watch America's Home Videos, something that makes you laugh, memes, to get yourself, sort of out of your head and out of your stress response. Connecting with others. I know that's super difficult right now, but we have to make an effort. If it's a walk outside, it's going to the dog park, it's spending time with family and friends playing cards. That's what we did over the holidays, even if it's just your smaller group, your bubble, if you will. Joining groups, whether they're online or in person, to learn new skills. And that makes a big difference, whether it's learning about film or book clubs, coloring groups, scrapbooking groups. But we need to get ourselves doing something that is creative that will help us feel more connected with others. Number 4 is focusing on that breathing. One of the biggest ones is that 10 in, 10 out. 3 to 6 times can make a huge difference. Just 1 minute of breathing in for 10 and out for 10, getting better to 15 in and 15 out 4 times. It's just 1 minute can lower that stress response, that vagal tone, in order to be able to help our whole body just sort of reset. That can be done with meditation tapes. In our office, we have a chart that has over 20 different apps on different ways to de-stress, meditate, so that you can have like a helper, a coach along the way. And there's many different apps that can be helpful for us to make that difference. One of them, for example, that's very popular is called Headspace. Number 5 is stimulating those palatal muscles. That's these muscles here that help you talk. So some of the biggest ways is humming, singing, tapping, um, chatting helps stimulate those vagus nerves and helps our body manage stress. So sing in the shower, guys, and have fun with it. So you'll see that laughing improves your vagal tone. But if you're not a singer, I'm not really good at singing. I hear my kids when they're working out singing. But one of the other ways is gargling can make a difference. Yoga can make a big difference, and cold exposure, which will come up to that, and exercise, because when you have to breathe harder because you're exercising, you're going to use those muscles as well. So this cold shower business, I don't like doing this. I know it's good for you. You see it at spas where they do the hot, cold contrast bathing. So for me, I need to start off slow. I might just start with a cold shower and then let it get hot, or just 5 to 10 seconds. As you get better, you can get to that 30-second finish with the cold water. But that does kind of reset your nervous system, your moods, your energy. So you see those polar baths. And some of the competitions now of those ice baths. But certainly it is good for you. But I'm going to say this one's one of the hardest ones for me. The anti-inflammatory diet, I can do this one, and many people, other people find this difficult. But this is reducing sugar, reducing foods that cause sugar. So you're looking at reducing even fruits that are high glycemic, vegetables that are high glycemic. I'm not saying no fruits, and no breads, but you're limiting those so that you're increasing your proteins, your healthy fats, um, getting rid of fast foods, and so not eating out. Number 8 is intermittent fasting. We have talks on the anti-inflammatory diet. We have talks on intermittent fasting in detail. So check these out. The one easier one is a 12-hour fast. So you eat in a 12-hour window, say from 8 a.m. to 8 p.m. As it gets harder, you increase the time of not eating, so that you're eating in a 6 hour or 4 hour period, or taking one day a week where you don't eat throughout that day. You have fluids that day. And often I will try that on Wednesdays. I choose my busiest day. So, because I know when I'm home and I'm near the fridge, somehow I'm hungrier. So, finding ways to motivate yourself to do the cleanse can help your body reset those inflammatory markers. Number 9, improving your gut health, and even testing your gut health. So see your naturopath, see your nutritionist, Dr. Udani Sabine, help check your gut health. See if you need probiotics. Do you need prebiotics? Um, do you need to add those different healthy probiotic foods such as sauerkraut, kefir, kimchi? Um, or different supplements. Those aren't my favorite foods. So, is it easier for you to do with a supplement format? Movement and exercise. This one is easier for me. We all have different areas that we help with, but one of the things to do is those HIT exercises. I just made a HIT program for one of my patients yesterday, with no weights, body weight, for her to do at home. It can be anywhere from 6 minutes to 20 minutes, 1 minute of each exercise. So if you want that, contact the office and we can give you that information. All body weight, no equipment, easier to do at home and to mix it up and match it with different levels. And then you want to mix that with stretching, things like yoga, Pilates. So this is jumping or bouncing for lymphatic drainage. You want to mix it up. You can't do the same thing every day. There's so much great on YouTube that is free. Start to look. That's what I plan to do. 2 or 3 days a week, I will just pull up a YouTube clip, and then you don't have to think. You just follow along. Movement therapy is huge, and it does help relax that sympathetic tone, just like getting the laughing and getting the gratitude time. And so that's dancing, dancing in your kitchen, getting movement, just one run around your block. Um, doing a trampoline or bouncing on a trampoline or just even bouncing on your heels can make a big difference. Even just shaking it out can make a big difference. And we know that stress, tension, trauma relief therapy, TRE therapy, can help relax that nervous system. So there are different ways if you've suffered from post traumatic stress disorder with trauma, you can use some of this movement therapy to help give your body a reset. And intuitive, we know this. Think of our kids. They got to move to learn, right? If you keep them sitting the whole day, they stop, they tune out, right? Teachers know this, parents know this, but guess what? Adults need it too. So lots of scientific benefits to movement therapy. You'll see how it affects your ears, your eyes, your nose, your focus, your things like headaches and migraines. It affects your blood pressure, your heart rate, improves your sleep. I don't think anybody can doubt that our bodies need to move. Just like a car needs to drive, our bodies need to move. Number 12 is taking a look. Do you need more magnesium and zinc? If you have low magnesium, you might get things like muscle cramps. You might not manage your sugar levels. You might have increased cortisol responses, increased inflammation, depression. So definitely look to add foods first before a supplement, and things like almonds, spinach, avocados, kale, pumpkin seeds, sunflower seeds, cashews. Look to add those healthy foods first, and then if you're finding or you're concerned, talk to your naturopath, your nutritionist, to see if you need a supplement, and then of course which one would be better for you. Zinc improves your immune system. If we go back to the slide right before, super important again for relaxing our nervous system, reducing inflammation, helping your vitamin D work better. And that's from eggs, oysters, lamb, cashews, turkey, pumpkin seeds, and sesame seeds. We can look at adaptogenic herbs, lots of different, like ashwagandha. There are supplements, like you see with Dr. Jocker's. This article comes from Dr. Jocker's, his cortical defense, but so many different things like rosemary. You can add these natural herbs, parsley, into your soups, into your foods, and a lot of times you barely notice that they're there. So just adding some of these herbs, or um, and as a spice, or just putting it right into your soups or your stews, um, or as a garnish to make it easier for you. There is a tapping technique, and the tapping technique often goes like this. You can tap on your chest. It's literally that gentle, along with an affirmation, and it improves our stress levels. This can be taught with a tapping technique person, or it can be taught with your naturopath, and it helps your whole body reduce stress along with the affirmations, and essentially helping them stick. Now, there are different types of apparatuses, like you see this headset, but honestly, you can learn how to do EFT, emotional freedom technique. You can learn from a naturopath how to do it on yourself. The hyperbaric oxygen chamber has been a huge help for me when my body has been under amounts of super parasympathetic stress. That's when, for me, I'm super allergic to dogs. Something happens, I just crash. I can't walk, I can't talk, I can't move. I get so weak into that crash that don't even go to the bathroom. So when you go to the hyperbaric chamber, there's one in Toronto, near the lake shore. It's run by medical doctors. It's typically about an hour and a half. It's like uh, going underwater, like kind of like scuba diving, about an hour and a half. You watch a movie, and usually afterwards, you feel super energetic and hungry. Cost is somewhere around $150. The doctors will have to assess you to make sure it's safe for you before doing that. But it does increase your oxygen through your whole body. So it increases your energy, helps your vagal tone. Chiropractic care, as a chiropractor, obviously, I believe in it. I get adjusted every single week. It improves your health, your stress, your sleep, your moods, your happiness, your immune system, your mobility. Your whole body starts to be able to move and function better. and you're able to do all of those other things better. So it's improving your brain, sending message to your whole body. And of course, when we're working with the nerves in your neck, whether with a manual technique, a table drop technique, or an instrument technique, that improves your vagal tone and your brain body connection. So you can see here in this picture, your nervous system controls everything. That vagus nerve that we're talking about, the longest nerve from your neck, goes down into all of those different organs and those little circles that you see. So super, super important in maintaining the C curve in your neck and the proper alignment. And that can be done with your adjustments. But if you're not able to get adjustments due to finances or distance, make sure you have the proper rehab equipment to do and take care of your spine and neck at home. So, learning how to use rolls, learning how to do tractions, we have videos on that. You can purchase the equipment from us so that at least you can do the information on your own. Much the same as if you can't get to the dentist, you at least brush and floss your teeth. All right. So, definitely get the equipment to help you function better. Massage therapy, we have massage therapists, 3 massage therapists at our office. It helps relax the body, helps de-stress, helps get those knots out. So very, very helpful in reducing that sympathetic flight or fight response. Along with that, I have had craniosacral therapy. That is working often on your neck and just behind your head and at the bottom of your tailbone. Very, very gentle technique, just as light as often as you would touch your eyes. And it can reduce tension and reduce stress. It is a super, super relaxing. Often people will fall asleep with somato emotional release or craniosacral therapy. You do need to find a therapist, physiotherapist, naturopath, or massage therapist who will do this technique. Acupuncture is excellent. I typically go once every 2 weeks or once a month. It helps rebalance, balance the chi, the energy. It stimulates that vagus nerve and can help reduce inflammation. And of course, our 20th way, we just went through 20 ways to reduce vagal tone and balance our bodies. But counseling, talking it out, making sure it's personal, gives us that support to heal. We don't have to believe that we can do it all alone. It's okay to have a coach. It's okay to have a friend, a peer. So this is the time to reach out. And remember that reaching out is a sign of strength, not a sign of weakness. I know in hockey it was like suck it up, tough it up, hold it in. But honestly, those are not good ways to cope. Right now, during these stressful times, reach out. We at the Justine Blaney Wellness Center are there to help you. We want to help you. That's why we have all of these amazing talks that are free and share with others. So we're going to talk coming up about that sweet spot, wanting that junk food, how to deal with those contaminated foods, how to deal with an anti-inflammatory diet, and how to boost your immune system. So stay tuned with us. We're here to help you be your best. And of course, please do a review. It helps us help others. And definitely share this information with friends and family. That's our mission, to truly make a difference worldwide. I look forward to being again with you soon.